So, continuing the questions from 200 onwards, January 2023. A tall man 180 centimeter is in sports physiology lab, which is the most vital capacity 2 liter, peak expiratory flow rate, force vital capacity 4 in first second, FRC, function residual, resting membrane. So it has to be increase in, there has to be increased for functional residual capacity has to be increased because of height. Peak expiratory flow rate in first second of 500, no. So force vital capacity 4 times in first second, no. D is the answer. What feature of mammogram is least likely to be suggestive of carcinoma? Popcorn, micro, speculation, difference in density of breast tissue, extracapsular spread. Mammogram least likely. This is least. Popcorn is least likely. Rest are all features. Post transplant 10 days low urine output, swelling, tenderness over the transplant site. This was the discussion. Acute rejection, renal vein thrombosis. So rejection, just tenderness not there. So renal vein thrombosis is more possible. Patient undergoes cholecystectomy, has history of sickle cell disease, stones are dark in color. Which is the big bile pigment? Or answer is A only, pigment type of stones. Sickle cell. Post transplant 10 days low urine output, swelling and tenderness over the transplant site, ureteric obstruction, again renal vein thrombosis. And what was that? B. So here there was ureteric obstruction. The same question is brought. They are telling swelling and tenderness over the transplant strongly suggest vascular complication like renal vein thrombosis, especially within 10 days. A female patient developed a recurrent loin to groin pain and in hematuria X-ray revealing radiopaque dipstick nitrates, calcium oxalate maximum positive. Most common is calcium oxalate. Left ureteric stone passes spontaneously considered screening. Cystine happens in this patient. 4 mm stone left ureteric colic passes spontaneously. Analysis shows calcium oxalate. Metabolic screening undertaken underlying even calcium oxalate, primary hyperoxaluria or hypercalciuria. Patient presented with ecchymosis in the joints, vitamin deficiency, joint ecchymosis. Vitamin C or D? Vitamin K. Yes, bleeding is there. Vitamin K. So adrenal gland relation to renal vein, artery, renal artery, ureter, inferior phrenic artery. What is this? Renal vein. So this about the next question. This was about 208. From 208 onwards, further questions has to be the another group. So here it has a, this was November 12. This was November 12 of that. So I have to go on November 12. This was 11 only. (212) onwards. Questions should be 212 onwards. So they are 212 onwards. Yes, landmark of pudendal nerve while giving pudendal block. Ischial tuberosity. Patient with slow growing firm lump in the front of ear pleomorphic adenoma. 25 hours stabbed in the chest, right side of the sternum. What is damage? Right side of the sternum. Where is his superior vena cava or right atrium? It is right atrium. Opioid work by which receptors? Opioids. Mu receptors. Patient post-operative given morphine, paralytic illness occurred, mu receptors. Intermittent positive pressure ventilation decreases end diastolic volume. About gastric emptying, contracts pylorus, no VIP contracts, submucous places, sympathetic contract, pyloric sphincter. Cholecystokinin contract okay, about pyloric sphincter, it helps to contract cholecystokinin. What is metabolic action of adrenaline? Vasoconstriction or glycolysis? Yes, adrenaline causes breakdown of glucose. That is important. Patient with fever and right side chest pain radiating to the abdomen. X-ray shows right sided pleural effusion. Which nerve is responsible for the pain? Phrenic nerve or intercostal? Intercostal is for the chest pain, phrenic for the shoulder. Extrinsic pathway. This is intrinsic and extrinsic. Extrinsic is factor 7. Azygous exit the diaphragm through which of the following? Azygous is along with the aorta. Patient with lung cancer with severe headache, vomiting, what will give? Steroids. Ganglion responsible for lacrimation, pterygopalatine. Chorda tympani exits through the skull, pterygopalatine, pterygotympanic fissure. Trigeminal nerve. What is depolarizing? Depolarizing, succinylcholism. Multiple traumatic patients with multiple broken ribs, ruptured spleen, and long bones found hypotensive. Pringles manual stop bleeding. Which of the following contains the vessel that occluded? Hepatic duodenal, gastrohepatic, gastro. Which of the following contains the vessel that was occluded? Gastroepiploic. No, it is. Pringle stop bleeding. Which of the following contains the vessel? It is not gastrohepatic or duodenal. Gastrohepatic, it is from the stomach to liver. Gastroduodenal. So gastrohepatic is not the word. Other name is gastroduodenal or hepatogastric. Hepatoduodenal ligament, part of lesser omentum. Yes. 80-year-old lady with widespread endometrial cancer and 5.7 centimeter right external artery aneurysm. Okay, right and external iliac artery aneurysm. What is the management? Age 80-year, open medical. 60-year-old lady presented with a fractured neck of femur due to accident. She has asthma, rheumatoid arthritis, taking prednisolone 10 mg salbutamol. What is advised to her steroid management? Increase steroid before and 3 days after surgery. C. 60-year male presented with the back pain and hypotension, now hemodynamically unstable. Back pain, hypotension. What would you do next? What are the options not given? Okay. Papillary necrosis in thyroid. Superior thyroid artery is lighted by new surgeon while mishandling thyroid removal. Post-operative patient not able to produce high-pitched sound. Superior laryngeal vagus. It has to be cricothyroid palsy. Horseshoe trauma to the middle of the chest. Pain, middle of chest. Pain, distended veins, hypotension, obstructive shock. Prostatic carcinoma metastasis vertebral artery system occur in long bones, new bone formation, osteosclerosis around vertebra. D. Lower anal canal lymphatic drainage. Lower superficial inguinal lymph nodes. Cecal carcinoma spread to para-aortic, iliac, inguinal, external, mediastinal. It go to para-aortic by mesenteric only. Mesenteric is there. Renal transplant, primary hyperparathyroidism, secondary, tertiary. Patient has dry mouth, bilateral swelling, hypercalcemia, sarcoidosis, bilateral facial palsy, rectal bleed, diarrhea, FAP. There is a polyp but no crossing the membrane. Dysplasia, metaplasia, neoplasia, hyperplasia. Dysplasia. Barrel associated with carcinoma, adeno. Dysphagia, disordered growth of abnormal cells confined above the basement membrane. Neoplasia, it has got new uncontrolled growth. Metaplasia, one mature hyperplasia. What type of epithelium? Barrett, goblet cells, columnar epithelium. Epithelium simple columnar with goblet. Barrett esophagus, metaplasia. Which of the symptoms listed below may be present in the patient with multiple intestinal hematomas and pigmentation spots around the mouth? Pete's sugar. Which syndrome is likely to present in a 28-year-old man who presents with locally advanced mucinous carcinoma of cecum? Scanty polyps and remaining colon. His father died from the colorectal carcinoma. Lynch or HNPC is not there, so Lynch is there. Mucinous. For sterilization, efficiency of autoclave is checked and found temperature not going above the 100 degrees, so Clostridium will not be. Which of the following method most effective to destroy spores of tuberculosis bacilli? Autoclaving. 42-year-old woman complains of burning pain on the anterolateral thigh which worsens on walking. There is positive tenile sign of the inguinal ligament. Which nerve is affected? Inguinal ligament means ilioinguinal. Okay, lateral cutaneous. Why? Anterolateral thigh. Anterolateral. Meralgia spastica. Varicocele. Which vessel is affected? Gonadal vein, renal vein, inferior vena, gonadal. 21-year female presents a 5-week history of pyrite bleeding and typically occurs post defecation. Examination inspection, anal canal shows called tag 6 o'clock. Patient declines the entrance inspection. Pain is fissure. Male complaints of abdominal pain, vomiting, and high bilirubin and increased ALT, AST, GGT normal. Increased ALT, AST, GGT is normal. So pancreatitis or alcoholic. And second is cholecystitis. Why? High AST, ALT with normal GGT, hepatocellular liver injury while causing various viral infections. A normal GGT is context suggests injury is not primarily bile ducts but rather liver themselves. Elevated CGT levels are primarily caused by liver. So answer was abdominal pain, vomiting, high bilirubin. Bilirubin is increase and increase. Okay, pancreatitis. 57 with diarrhea and bicarbonate level. High bicarbonate, diarrhea. Increase, decrease. What? Diarrhea, bicarbonate will decrease. Hemisection which will be expected changes from C5 brown sequard. Hemisection spine at C4 will be expected changes below C5 brown sequard. Hemisection is brown sequard. That is the question. What maintain resting membrane protection in skeletal muscle? It is potassium. So this was again continue for the next question from 2. This was the question number 261. So if I get the same page, okay, I will stop it here.